And welcome, 1, 2, 3, 4 of us, to tell you today how you need to be fit and where you need to go to get your physicals and all of that. New year, new you. We're winding up January with this, and we do thank the primary care urgent care is in the house. We thank them for their sponsorship. They care about your health. It's that simple. We have Dr. in the middle, Dr. Shandal Emanuel, and she's kind of the leader of the team over there at Primary Care Urgent Care. We have Haley Frazier, and we have Wayne Tamberelli. Good morning.
Good morning.
So glad to have y'all here. First of all, I'm going to let Dr. Emanuel introduce her team. You have Haley Frazier. Is she the newest member of the team?
She is our newest member. She joined us in October. Part-time originally, but she's been full-time since the middle of November.
Okay.
She predominantly works on the urgent care side.
Okay. All right. And now we have Wayne.
Well,
Tell us what you do.
I was part of the original team. I'm director of the urgent care, and Haley is the best partner I could have.
Wow.
So we work the urgent care side pretty efficiently.
Well, I can't help but hear that y'all are just booming over there.
It's a lot busier than I anticipated, actually.
Well, a lot of people just followed you. They wanted to go where you were, Dr. Emanuel. Is that correct?
That's correct. I think I probably took about 80% of my patients from my previous employment.
That says a lot.
And every day I have anywhere from 2 to 5 new patients a day that have been referred from family members, members in the community. Had a lot of changeover with some of the other practices.
Mm-hmm. Right. So how does it work? So you're on the primary care side.
Correct.
And then the urgent care adjoins the primary care. So if there's anything, if Wayne or Haley say, I want to ask the doc a question. Well, all they've got to do is go across the hall.
Correct.
And you're right there, so you're in the building.
I'm in the building. A lot of times, especially with the younger children, two and below, I'll see those urgent care patients in the midst of my primary care patients.
You have a passion for the children, don't you?
I do. I mean, I'm a board-certified pediatrician and an internist, so I do love the kids.
Yes, and that's good. That's always good that we know somebody cares about our kids. So what are you seeing now? I know there's a lot of flu and all of that, so it's just prevalent right now, isn't it?
We're in the tail end of our respiratory season, so we've had a lot of COVID, flu, and RSV, strep. Kids coming in with strep.
My granddaughter has had that.
Right after Christmas, I think we had a real boom in our business where families were getting together and sprering love and germs.
That's how we spread love.
Yeah. So we've been very busy. The urgent care is slowing down some, but we're still seeing, the RSV, the COVID flu.
Mm-hmm. Well, I'm glad to hear you say that we're kind of at the tail end because, everywhere I go, somebody is out sick or something. So we want to be well, and it's so important. New year, new you. We want to get our physicals. How many people just come to you and say, well, I've never been to a doctor?
I've had quite a few. I actually had a 74-year-old man come into the urgent care a couple weeks ago, new onset heart failure, no past history of heart disease, hypertension, nothing, but he also hadn't been to a doctor in 50 years.
Wow. Well, prevention is so important, and there's so many things you could catch in lab work or whatever
or just a physical exam.
Physical exam. If they were just
listening to your heart.
Yeah, exactly. Well, it is important to get your physicals. It is so important to go, and so tell us, if we want to go, at the urgent care, is it a walk-in situation?
Yeah, you can walk in from 9 to 6:30. And we see, like Dr. Emanuel said, we see a lot of COVID, flu, and RSV, and children, other respiratory illnesses as well. We see a lot of injuries, and that runs the whole gamut of whatever you can hurt, they come in with it hurt.
Sure.
So we take care of a lot of those things. And a lot of the patients that Dr. Emanuel is getting is they're saying they're so happy with the care we're providing that we refer them to Dr. Emanuel. So she's getting really overloaded.
Wow. Well, that's okay. She'll make room.
We actually have another provider that we hope to start in the fall.
Oh, really?
Yeah, she's my F&P student right now. So once she's done with her clinicals and she takes her boards, we're hoping that she'll come on in probably early November.
So you're really growing.
Yes, but she's going to come on as a primary care provider.
Okay. And so if you need a physical or something like that, you do need an appointment for
Correct.
for the primary care.
For primary care, if you're trying to establish. But we
Yes.
have also offered sports physicals, employment physicals for state employees, especially that need to come in and get a physical and a TB skin test. They can actually do that on the urgent care side.
I'm hearing, is tuberculosis coming back?
It's not coming back. It's just it's a requirement for the state to
Okay.
be screened.
Okay, I had heard, I don't know, somewhere that I thought it might be popping up somewhere, but anyway, okay, so, and you will do, what about shots for kids that are starting to school? Do you do those?
We do. We offer vaccinations, but you have to be established with me to get your shots.
Okay.
Because I need to be able to track that, and kids
Sure.
need to have a pediatrician. We don't turn kids away, so
Right.
I mean, we have worked children into my schedule to be seen within a day or two to get their vaccinations. I also partner with the health department, and they do a shot clinic there. I'm their medical director for pediatrics, so they will offer immunizations there if kids need to get catch-up shots.
Mm-hmm. Well, Haley, you're the new member of the team,
Yes,
so
ma'am.
how do you like it?
I love it.
Okay.
We see a variety of patients from RSV, COVID, pneumonia, bronchitis, almost everything that comes in. We definitely treat it very
Right.
well. So we have a great team,
Right.
Wayne, Dr. Emanuel, and I.
Did you live here? Are you from our community?
So I was raised,
Not
born
that
and
matters.
raised. I was born at Nash General Hospital, which is UNC Nash now.
Okay.
And I was raised on Red Oak Road in Nashville, North Carolina. So all my
Okay.
schooling's around here as well.
Well, people are probably watching you now that know you, so. That's the good thing about local television, y'all. Everybody know, oh, I know her. Yeah, I'm gonna go over there because I know her. Everything's association here, so.
And she was
In
my
our
student
community.
as well.
Really?
Yes.
Yeah, there's another good thing about our practice that patients really like is that we have our own x-ray and our own lab.
You have
and a lot of-
state-of-the-art equipment that
Right.
I saw.
Right. And so patients, when you say, well, I really want to get a chest x-ray, they go, oh, thinking they have to go to the hospital. We say,
Yeah.
no, just come with me, I'll bring you around the back. And so they really like that, and it is state-of-the-art. We get results immediately.
Wow. So, well, that's a good thing. You can stay right there, get it done, get your results. I mean, do they get the results pretty soon? I mean,
Within
quickly.
minutes.
Yeah.
Within minutes.
Okay.
I mean, we
wow.
actually look at our x-rays as soon as they're done, and then we have a radiology overread that sends us a
Right.
report.
Wow. Well, that is, everything is so convenient there, and we haven't talked about where you're located in case you've been living under a rock. Where are you located, Dr. Emanuel?
We are located in Nashville, right behind Bojangles, right across the street from Ribeyes,
Mm-hmm.
and Dunkin' Donuts, and KFC. so-
Yes. Do you go to Dunkin' Donuts, Wayne?
No, not ever. No
We
offense,
are
Dunkin'
New Year,
Donuts,
new
but
you. We're not going there.
I'm not a donut person.
Okay. So what do y'all encourage for us to do to be in better health this year? To do, resolutions, forget it. I don't even believe in resolutions because nobody keeps resolutions. It has to be it's got to be a lifestyle change. It can't be something you're going to do for 3 weeks. Oh, I'm going to go on a diet for the next month. That's crazy.
Right.
It's got to be a lifestyle change. So what do you recommend as the whole to run the gamut to make you a healthier person for 24?
Start off with your physical. Get your
Yes.
up-to-date physicals, labs, health maintenance, for women, mammograms, colonoscopies, colon cancer screening for men and women.
Yes, that is so important.
It is important.
Yeah,
So
absolutely.
we've actually started, now the recommendations are we start screening at 45 for the general public, and then 5 years earlier for patients that are at high risk that have a strong family history of colon cancer.
Okay.
Women, get your pap smears, just your routine health maintenance.
Your mammograms, all of
Yes.
that.
Make sure that you're active. It doesn't take going to the gym to exercise. We got really creative during COVID when all the
Yes,
gyms were
we
shut
did.
down. You can do a lot of things at home.
That's exactly right. And I tell people, I don't like to exercise. It's not what I prefer. But I know I've got to move. I mean, I have a desk job a lot of the time. Now, I'm out a lot. But I know that I need to move beyond that desk several times a day. And if you do, and I've said this on this show during this segment many times, Dr. Patel and I were talking from the hospital. If you do something you like, if you have a regimen you like to do, such as walking, I like to walk. Well, then walk, because you're going to stick with it.
Right.
If you do something that you're hating every minute of, walking on a treadmill, exercising, something, if you just dearly hate it, you are not going to stick with it. But if you like to walk, would you agree with that?
I do agree with that, and especially as we get older, add some low weights. We lose bone mass as we
Yeah.
age. So just adding like a couple of pound weights while you're walking
Yeah.
can help increase your bone densities.
You can even do that in your living room.
You can. I don't like to exercise either, but I really enjoy Brazilian Jiu-Jitsu.
Oh,
And
really?
I just got my blue belt in January 6th.
Wow.
So my husband and I do it together with Gustavo Machado here in Rocky Mount under Eric Griffin. And I've been doing it now for about 2 years. I do that and kickboxing, and that's where I get my cardio.
That's a really good workout.
And that's why we obey everything she says.
Yes, yes. You better watch out. But so where do you do that? Where is this place?
It's in
Because
Bienvenue
people-
Plaza. It actually just expanded. They just celebrated their 10-year anniversary.
Okay.
It's down in the plaza with Brian's Cheesesteak.
Oh, yeah,
across
yeah,
from
yeah, yeah.
Omar's Tailor
Right.
Shop. Yep.
Very
And so they just expanded, opened some new classes, and it's for everybody. Kids and adults. We have beginner classes to higher levels. We actually have now 8 black belts, and my husband just got his brown belt.
Oh, good for David.
Yes, so.
Very
So
good.
yeah, we've been excited. So that was our new news for 2024.
Okay. Well, you started off the right way, and all of us need to start off the right way. And diet is also, it has to be included with the regimen of exercise and all the other physical, getting your physical. But eating right has got to go right along with it also. Would you agree?
I agree. You really cannot out-exercise a bad diet.
Right. So that's so important also. So, well, we really appreciate y'all's sponsorship of New Year, New You. And from what I'm understanding, we are starting and also y'all will be on next Wednesday night with Linda Prezioso. Next Wednesday night, you'll be on with Linda Prezioso on Here's Your Good Health. So you can watch then. I don't know which of the team will be on, but anyway, you can watch then for more information. But we have that's our night audience. This is our morning audience. But anyway, y'all are going to join us for our Heart Month in February. So we're so glad that you're doing that as well. We'll start Heart Month, and we'll really start talking about cardio and all of that. So anyway, thank y'all for joining us this morning. Primary care, urgent care, located across from Ribeyes in Nashville. Just go right on over, and if you have a issue where you need an urgent care, go right on over, walk right in, and you'll see Haley, you'll see Wayne, one of the two. You might even end up with Dr. Emanuel, who knows? But anyway, they're there. They are there to serve you Monday through Friday. What are the hours again?
9 to 6:30.
Now, you're open on Saturday part of the day, aren't you?
Mhm.
8 to 1 on Saturday. We take our last patient at 12:30. And right now, while we're still getting some additional help, most Saturdays I'll be there.
Okay. Well,
But we
that
do
is
close
great.
at 5 on Fridays. So we
Okay.
did change our hours a little bit for Friday. So it's, the urgent care is 9 to 5 on
Okay.
Friday.
Well, at least they stay up until 5, because a lot of places, they close at 1, so you might as well go right on over there if you need an urgent care on Friday, because it's hard to find a doc on Fridays. But anyway, primary care, urgent care, I urge you to go, and if you have not had your physical, Dr. Emanuel urges you to come. She
Yes.
will be glad to have you, and you can set up an appointment and go right on and get your physical and feel better about yourself and your health. So thank y'all for being on
Thank
this
you for
morning.
having us.
Thank you for having us.
Absolutely. All right, we're going to let these folks get to work, and we'll be right back.